is anesthesia. So you probably heard a lot about that. A lot of I can't use this, I got to use that, I don't know how to use this, I can't get that, so all of that. So please welcome Senator Schiavone.
We'll go back to this short, or extra short. All right. I appreciate you giving me the opportunity to be here with you today. I've had an opportunity over the past 5 years to go to all different size pharmacies, all different kind of pharmacies. I've been to compound pharmacies. I've been to places that do intravenous drug delivery and in-house distribution. I've been to small pharmacies in Cornersburg. I've been to large pharmacies. And the thing that I hear over and over, no matter what size or what exactly your specialty is that there's so many restrictions on what you're doing that you don't get to adequately discuss issues with the patients, put that extra care into what that patient needs because you're so worried about all the different things that you must accomplish before that person gets out the door and then get ready for the next person to come in. And my brother's a pharmacist down in Florida. He decided, he went to Temple and decided to put his application down in the Keys, and he got a job in the Isle of Marada at Public. So feel bad for this guy. But he has the same issues, you know. He got into it. He's the kind of person that is a very likable, charismatic, hardworking, smart person. He thought he was going to go into it and really get to help people and really get to give his expertise and lend his expertise to make somebody's life better. And he feels that same pressure of constantly having to turn over and get the job done so that he can get to the next one. And so that's an issue. Now, Antonio spoke a lot about the bills. And so I was real proud of myself. I did all my research and all my homework, and I was going to explain all these bills, but he did it all. So I'm not going to get back into those bills. But some things that he mentioned that I really want to echo is that your voice is very, very important for these issues. Now, the legislators have to answer to you because you're the voters. And if you're an educated voter that goes in there with you go in and you be polite, but you be stern with that person and say, how do you feel about this particular issue? Is there something that we can work on with this particular issue? It means a lot to legislators because you're the ultimate boss of us. If you don't vote for us, then we don't go down there and we don't have positions in the state Senate, the state House, and in Congress. So it's very important that not only do you go and advocate for your positions and advocate for the people that you try to help every day, but you encourage those patients, those people that come into your pharmacies to do the same. Because, you know, when I go into the smaller pharmacies and I saw with my own eyes that, you know, an 80-year-old woman is being turned away from getting her medication because she got a letter in the mail that says she has to go to mail order. Or that she has to go to a certain pharmacy because that PBM is part of that certain group. And it's something that is, it's just frustrating to me. And I know it's frustrating to all of you. I've also seen the fact that, you know, a tube of a certain medication might be $30 one week, and then the next day when you go on there, it's $500, and then you have to turn that person away and tell them, I'm sorry, Mrs. Smith, I know that last week and for the last 5 years I gave you this medication, but I can't give it to you anymore because I can't eat $470 and still turn a profit and create a business that's sustainable. That's a problem. And those are the bills that we're talking about, that Antonio was talking about. You know, there's some easy ones. And he mentioned the easy ones about dispensing medication in emergency situations and about the immunizations. Those ones are the easier ones in my opinion. The ones that you really got to dig into and the ones that are very complicated are the ones with the relationships with the doctors. Because, you know, there's something that I've noticed in the past 5 years of doing this job is that nobody ever wants somebody else to have the ability to do something that they can do. So it's like the person that's here is always trying to step on the person that's here to say, no, I'm the only one that knows how to do that. You can't do that. So that relationship with the physicians needs to be fostered a little bit, needs to be grown a little bit more. And how that happens, that's the difficult part. But I think that it's starting to. And so for me, I just wanted to come tonight to kind of talk a little bit with you about issues that you're facing. And so I don't pretend to be an expert in this. When I don't know something, I listen and I try to learn so that I can be the best legislator that I can. And I think that as a young guy, I was 29 when I started this, and I'm 34, but I'm still the youngest legislator. And so I learn stuff every single day, and I don't shy away from saying I'm not sure about that, but we'll get back to you on it, because you have to have an informed answer, so that if you don't do that, you sound like a complete idiot. So I want to make sure that I have the proper information from you, boots on the ground, so that I can bring that down to Columbus. So with that, if people have questions or comments, feel free. Thanks, Ryan. Real nice.
Okay, question.
Yes.
You talk about bills, and I think the work that you're doing is great. One of the issues that we see is, healthcare is a 24/7 business. And insurance companies they want to be a Monday through Friday business. And so we have huge issues with 7-day communication with the insurance companies, prior authorization, so on and so forth. Pharmacy has that issue, hospitals have that issue, and it just increases length of stay in the hospital situation, because these people aren't open 7 days a week. They don't provide services 7 days a week. Guess what we do? So that's an issue. If you could address that somehow, I think that would be important to solve that.
No, that's a major issue, and I've heard that before. I mean, how are you supposed to do your job adequately if you can't get a hold of somebody on the other end that's supposed to tell you what you need to do in that particular situation? So, I mean, I'm with you on it. And some of this stuff crosses over like state into federal and kind of merges together. So these issues can be tackled both at the state level and at the federal level. And with the whole change with the healthcare system, it's a work in progress, and it's a moving target sometimes, and that confusion creates frustration. And so, but that's definitely something that I've heard about, and I'll work on trying to address.
I just want to say we have an open mic here that will help for everyone to hear if folks would be interested in coming to the microphone.
Senator, thank you for being here. We were at the Ohio Pharmacists Association meeting a few weekends ago. Their House of Delegates passed a resolution. It was concerning a bill that is pending. I'm not sure if it's the budget bill, that has a stipulation that the executive director of the Board of Pharmacy no longer needs to be a pharmacist. The House of Delegates for OPA passed a resolution that opposes that position. EOPA hasn't had an opportunity yet, but I'm sure we're going to get to chiming in on that. A lot of us have concern that the number one individual at our boards of pharmacy will not be a licensed pharmacist. I was wondering if you had any comments on that.
I really, I'm not sure exactly where that is. Antonio, is that in the budget?
Yeah. Correct.
See, the budget becomes something that isn't a budget anymore, because why would that be in the budget? But it is, because the budget starts out as a budget and then it becomes a huge mass of amendments. And so that just passed through the House and is coming over to the Senate here in the upcoming weeks. And I'll address that with my caucus. We have 10 members out of 33. Republicans have 23. Democrats have 10 right now. And I'm the leader of the minority caucus, so I'll be sure to mention that to the 10 members. But just on its face, that makes no sense at all. And there has to be sometimes there's these weird reasons why maybe they want a certain person to do that job that isn't. I don't know. I'm just saying I've seen things like that happen, so we'll see though, but that's something that I'll keep my eyes open for. Thank you.
Hi, my name is Rich Renchak. I'm a retail pharmacist.
Okay.
How many people in this room are employees versus working for themselves? Show of hands, how many of us work for somebody else? So the vast majority. The biggest problem we have is nobody is looking out for us. OPA, I think what you're doing is, the things that you talked about are beneficial, but when you asked about having a collaborative agreement and you have a whole room full of pharmacists and nobody has that, The biggest problem I have with OPA is that you don't do anything to address us working pharmacists. We are being put into conditions that are basically unsafe. I mean, there are a lot of times where we've had 3 pharmacies held up in about the last 4 or 5 months. One of the chains, there were 2 chains involved. One of the chains wouldn't even give the pharmacists time off who had a gun pulled on them, were forced to give up narcotic prescriptions. It's wrong. I mean, there's no way you should be able to have a gun pulled on you today and then the chain says, oh, well, you have to show up to work tomorrow, you have to make up your hours. It's an unsafe situation. I wouldn't want that pharmacist checking my prescriptions. I'm sure you wouldn't want that pharmacist checking your prescriptions. The other problem we have is the employers constantly will say, we have no say in how much help we get. We have no say in controlling our destiny. As far, you'll have a district manager come in and maybe they had a bad quarter and will say, we're going to cut. You have to cut 20 hours out of your budget. Well, why? My numbers aren't down. They just randomly come up with this. There's no pharmacist to technician ratio. There's no pharmacist to prescription ratio. I think the biggest concern most of us have, at least those of us in the retail environment, is the fact that we are consistently put in a position where we have to make unsafe decisions a lot of the time. We have to work in an unsafe manner because we don't have the physical bodies in our pharmacy that we need in order to fill prescriptions safely. None of it, I don't think there's any of us here that are represented by unions. I don't know how many people would want to. I was raised a Democrat, voted more conservatively recently, but I was an old union guy. My dad was a union rep. I think a lot of us are looking, would like at least at the, OPA, the legislature, somebody to look out for us because we feel like we're the forgotten, we're the forgotten ones that are out there. Nobody's looking out to, for our interest and to make sure that we're filling prescriptions in a safe manner for the public. The state board fails us on that. They really do. I'm old enough, I started out with far more. There were, I think, in West Virginia, Iowa, there were several states that actually went to pharmacist technician ratios because far more had cut the help so much they ended up killing people. I know that happened in West Virginia for sure. How would you feel? Do you think there should be a pharmacist to technician or a prescription per hour limit that we should adhere to? I mean, you've got pharmacists for CVS that work 8 o'clock in the morning to 10 o'clock at night, no break, no lunch, no meal. And I just think it's wrong. We don't get time and a half after 8 hours. There are a lot of issues that I would love to see OPA address that affect us as employee pharmacists as opposed to the business pharmacists. You take care of the business pharmacists pretty well. Nobody's looking out for us as employee pharmacists.
Okay, well, I appreciate that concern. That's something that needs to be addressed because I do hear that complaint a lot. But I have not seen any draft legislation that would do anything to remedy any of the issues other than there is a bill that I'm working on because I'm a workers' comp lawyer. So currently in the Ohio Revised Code, you cannot get a workers' compensation claim approved unless there's a physical injury that causes a psychological injury. And so what I'm trying to do is get a bill passed that would allow for a psychological injury only to stand on its own as a workers' compensation claim, which would in some ways help some folks that have gone through traumatic events where they probably have PTSD, but they don't have any physical injury attached to it. So that's a very fringe issue to what you just spoke about, but I will work with Antonio on it and see if there are ways that we can make those improvements because I do recognize that to be a problem. Are there any other questions? Yes.
Seeing medical marijuana be such a big profit center for companies in Colorado and Oregon, where is the legislation in Ohio and how, and if it's moved far enough forward, what's the distribution network for it?
I'll just be honest, the medical marijuana will not pass the Ohio legislature and get signed by the governor anytime soon. Because I just know that, people down there, it won't work. The numbers aren't there for it. The governor said that he's not for it, so it's not going to pass. But it can get passed via ballot. So if they get the requisite amount of signatures, if people are out there, which they are trying to get the signatures now, and you get the requisite amount of signatures, you can get it on the ballot and have the people vote and circumvent the legislative process. So if that happens, it might pass. And, there's all different versions of medicinal marijuana. Some people say that and they think, well, if I have a headache, then I can smoke weed, that's medicinal marijuana. Other people, we're talking about children with epilepsy, that if you could reduce it to a liquid form where you get rid of the THC and they can't get high, and you mix it with vegetable oil and put it on their food and it reduces epileptic seizures, that sounds reasonable, and most people will say that. Most doctors will say that. So there's different versions and variations to it. But a legalization of marijuana is not going to pass the Ohio Senate. It's not going to pass the Ohio House. It's not going to get signed by the governor. And right now, I think the group that's trying to circulate the signatures is struggling to get that requisite amount because it's a pretty high threshold. So, in my knee-jerk reaction opinion to that is that that's not going to go anywhere anytime soon. But I do think that getting into researching certain ways to prescribe the plant is something that might in the future get some traction. Not Colorado, not the medicinal for whatever reason, but something I think might be done. And I think that I actually would be in favor of something like that. I mean, I've had kids come into my office, mothers bringing kids that are having seizures in front of me, and they're moving out to Colorado because it's been proven to work out there for those particular things. I mean, that's hard to argue with. So there's different levels, but I'll keep people posted as it proceeds. Anything else? Yes.
All right, when you think about Steve or Brenchak over here, he was talking about prescriptions per hour be filled by a pharmacist, a maximum amount. Would you consider introducing legislation yourself to that effect? Talking to some of the pharmacists here or other pharmacists around the state, the maximum amount of prescriptions you can fill in an hour?
Yeah, he's talking about the maximum, putting some sort of cap of the maximum you can prescribe in an hour. I don't know. I'm just thinking about how that would work in legislation. I mean, you would be telling, I don't know if we could do that at the state level. You'd be telling every single individual company how to run their business. And I guess that we do that in government a lot, but I'm not sure exactly how that would fly. I mean,
all right, I'll give you a number. All right, I'll give you a number. 120 scripts in an 8-hour shift, one pharmacist, one tech. That's the rule.
13-hour shift, that's ridiculous.
All right, 120 scripts, 8 hours, one pharmacist, one tech. How's that sound?
Doesn't sound safe.
Employees need to be held accountable.
Well, I'm just thinking out loud of how we can form this in a way that we can get meaningful legislation that would have a good opportunity to pass.
Make it a law.
Well, that's what we're talking about.
If they want to have all these consult agreements, that takes time. You want to counsel patients, get reimbursed, that takes time. If you're filling 300 scripts in 8 or 10 or 12 hours, you're not going to have any time to look up for anything. And they take a lot of shortcuts. I don't work in such a situation. I'm really glad that I don't. And I would never want to work in a situation like that. But I'm telling you, it's terrible for the public. And I don't think the state board considers the public, I think they almost consider them expendable. Because they're being sacrificed. A lot of errors are being made throughout all of medicine. And it's been carried right through. Nobody's catching the errors. I see that where I work. Okay, I'm catching the errors. They go out and they're not caught. And I know that. And you can't blame the pharmacists because they're being pressured to fill an unreasonable amount of prescriptions per day.
Right up to an unsafe level.
Way unsafe.
Yeah, I think it's sensible. And as you brought it up earlier, I would just have to figure out how to craft something that would, we have to find that right amount, that what is reasonable amount. And so we have to work on that through the association, through individual members, and try to find something that is doable, reasonable, that we can get past. But I think that it's sensible.
If I could add something on here to this issue, this is something I've done a little research on, and taking off my president's hat, putting a pharmacist hat on for a moment here. Currently, in the United States,
the number of states that have any sort of legislation that regulates the number of prescriptions per hour, prescriptions per pharmacist, or anything like this, the number of states that have any legislation like that, 0. There are no states that have any legislation like that. So this is something that we would be groundbreaking on. So this would be a more difficult issue for the state of Ohio, because we would be trailblazers on that. And another issue here that I think is an organization that we can be looking at in the future, and that's the nice thing about having a large group of people getting different thoughts and opinions and formulating things, as we'll be talking about resolution process and the like. There are 13 states in the country that have legislation on the books that allow or require a 30-minute break after, or if a pharmacist is working at least a 6-hour shift, you are required to have a 30-minute break. As I said, there's 13 states in the country, and these laws have been in place. Most of them were put into place more than 10 years ago. So it's a tried and true system. A lot of the laws that are in place allow the pharmacy to remain open with limited services. Most of them would be, is the technicians can stay in the pharmacy, they can dispense, or they can sell prescriptions that have already been checked by a pharmacist. If they are refills, they can accept new prescriptions. In most of them, the pharmacist has to remain on the premises. Now, what the premises would be is, let's say this is Walmart. You don't have to stay in the pharmacy at Walmart, but you have to stay in Walmart, for your break, let's say, on there. So there is a lot of precedent for that. There's ones that limit a pharmacist's work shift to no more than 12 hours, so that there is a lot in a number of states, and I have some information on that. So Senator, that's something, I think that first one is something that would be groundbreaking for us, that would require a lot of work to convince the legislature that that's something we could do. But as an organization, as far as and that you can look at almost as a win-win to the employers or the owners too, from the point that you can keep the pharmacy open. You don't have to lock the doors, pull down the screens or whatever. You can still do some dispensing. Most of them do not allow the dispensing of a new prescription to that patient. Even the pharmacist has checked it. If the pharmacist is not there, the technician independently can't give that new prescription to a patient, but could give a refill. They'd have to have a sign posted to say that the pharmacist will be back at 1 o'clock or whatever, and then it can be dispensed after that. So I just want to add that in as clarification.
And safety has to be the number one concern. And so if it's not, and if making money is the number one concern, then there has to be some balance. And I think that's where the rub is, and that's where I can sense the frustration. So it's something we definitely work on.
If I could add, most of us are considered salary exempt. And that, it's not like it was 30 years ago when you were working for yourself, you had your own, it's pretty much abused across the industry, at least in the retail environment. I mean, if they were forced to pay time and a half after 8 hours, you would see a lot of changes made. California actually did that about 10 or 15 years ago. They went and they said, nobody's going to be salary exempt anymore. Unless you truly own your own business or something like that. We're getting rid of salary exempt. If you're a doctor, you're a pharmacist, a nurse, and you work over 8 hours, you're getting time and a half. That changes a lot of the way the businesses look at it then, because nobody likes the overtime, so then they're forced to put more help in. They're forced to hire more people. Well, there's the CVS, I think, up near YSU, they work 8 in the morning to 10 at night, no lunch, no break. Not to single CVS out there, there's other people that do it. It's just wrong. You shouldn't have to work a 14-hour day. And a lot of times, when you're scheduled, you might have a scheduler say, hey, you're going in for 10 hours, you're going in for 12 hours. You don't have, you should be able to refuse that, say, no, I don't want to work more than an 8-hour shift. And it's just a safety issue, because there's no way at the end of that shift, especially if you're busy, and almost all of us are busy now, there's no way you are safely getting prescriptions at the end of a 10 or 12-hour shift.
Just like anywhere, you're 100% right. Well, I appreciate the opportunity to be here. I can tell these big guys creeping up on me here. And I'm going to head to one other event, so I'm not being rude to leave the meeting, but if there are issues, I don't care. I mean, I represent Mahoney and Columbiana County, but whatever county you're from, if you want to discuss the issues, they have my contact information. Don't hesitate to call. I'll come check out your place, and we can talk about the issues further. So I appreciate the opportunity, and have a good rest of the meeting. Thank you very much.
Senator, thank you
got my
very
body
much.
here.
Ray, do you want to do anything in here, or we'll just go on with the...
You know, I actually think it's a perfect opportunity. It'll be quick. We had, as officers, been going back and forth on presenting a resolution. We sense that we need to have something that will bind us together in one way or another, something that we've all acted on, and I think it works beautifully with some of the comments that we've heard. I believe we sent this resolution out. If not, there's a copy of it in your packets. It's very general. I'm not going to read it, but if anybody wants to make comment about it, we'll limit the comments. I think we really did have good open mic session here, so I think it's just going to be a matter of everybody raising their hand or saying aye, either in favor or against it. We heard some of the issues that we're facing, and every practice setting has their own. I know as a compounding pharmacist, right now we have HR 3204 and the FDA removing authority from the Board of Pharmacy to oversee sterile compounding. That's huge for pharmacy. I've worked for an independent. I own my own store now, so I know what it means to buy a bottle of pills for $300 and sell it for $301.12. All of us are aware of the overdose rate of Ohio citizens, 1 every 5 hours that's dying. 70% of those deaths are occurring from prescription drugs that we had in our possession to begin with. We believe strongly that part of the reason why we're not able to make eye contact with these patients that are coming in is because these hurried paces that we have, and heads down, entering data for the PBMs, who in fact gather this data and end up using it against us to say, oh, so you're not efficient, you're not cost savings, let's have a specialty pharmacy take care of these 5 million people, or this mail order place. So all of this time and all of this effort that we're using to the dispensing, get $1.10 in return, where do you stop with these issues? These are the sorts of things I don't like to mention to my daughter Emily, who's a P2 at ONU. And I like to stay very positive, in some of these things. The positive part about this is that we can come together to fix these things. Believe me, I think if we wanted to limit the number of prescriptions per hour, EOPA is only 6 counties in a little corner of Ohio. We're District 14. The other locals are shrinking and fading away. They're pretty much non-existent. There are 13 other districts that could match the energy that we have. If you think of the number of citizens that we talk to every month, if you think of our income, if you think of the amount of cash we have as individuals, the fact that we fight for the #1 trusted position, most trusted profession in the country year after year, you could not put together a better group of individuals to lobby for. And if what we have going on here can be elevated to take this to the state level and encourage the other districts to do exactly what we're doing, whether you're a member of OPA or not, or whether you care to join it, if they can redistrict their locals according to the other 13s, it makes everything feed up easier. There isn't any reason why the concerns that Rich is expressing on some of these things, we set up a committee and figure out what's best. How many prescriptions an hour? I don't know. I can't even say right now whether I'd be in favor or against that. It doesn't matter. It doesn't matter at this point. This resolution represents a process. If we wanted to say, whereas we feel a pharmacist ought to be in charge of the Board of Pharmacy because blah, blah, be it resolved that the Eastern Ohio Pharmacists Association believes this to be true, Senator Schiavone now knows that we have 500 pharmacists in our area, that we have 850 that are networking. When Paul or one of us go and speak to them, it's not a few people that are just giving their opinion on what that might benefit them. It's coming from 500 people. Some of these things are getting pretty interesting, though. Some of these issues have been able to grow to the point where it's a little bit risky for some of those who are willing to step forward and speak on behalf of the others that might not be in a position to do it themselves. A drug I've been compounding for years and selling to high-risk pregnant patients at $25 a vial came out on the market priced at $7,500 a vial. And it's an identical copy to what I've been making. Well, how much of a stink am I going to make against drug companies? Many of you don't realize one of the issues, the thorn in my side, the initial thorn in my side, that binds all of us together, is the fact that I've got a contract to my pharmacy that at the very top of it said, witnesseth, be it therefore that I'm not allowed to say anything negative about the patient, the plan, the doctor, or anybody associated with the health care of that patient. If we don't see this as being something that really binds us together, all as RPHs, it doesn't matter if it's, some things are very specific to independence and hospital, the administrative cost burden. Some things are very specific to a particular practice setting. The fact that you would allow PBM to send you a contract that would deny you right of free speech, not to say anything negative, is it legal? Probably. Is it appropriate? Definitely not with the number of overdoses that we have. Yeah, definitely my thorn. And to me, I look at some of these negative issues and I think to myself that we have 6 counties here, and we have an example of what the rest of the state can do. We can pass whatever we want in the Ohio legislature. I believe that. We interact with way too many citizens not to have that pull. Mr. President, I stand in favor of this resolution. I ask the rest of the members present here to pass it.
Okay, thank you. Just the comment on there, as you see, and many in the room may not be that familiar with the resolution process, and this is very, very, very powerful at the state and national level, and as you see what we can do here. So as we move into the future for more resolutions, as we're talking about here, this is the way for us to thoughtfully speak as a group in here. So regarding the resolution that is on the table, are there more comments or discussion?
Second the motion.
I'm sorry?
I'll second the motion.
Second the motion? Okay, hearing no further discussion, we'll call for the vote. All in favor of passing the resolution in hand here, resolve that the current membership and officers of the Eastern Ohio Pharmacists Association continue to work to form a strong membership base, gain consensus amongst those members, and for EOPA leadership to bring such consensus to the attention of legislators, agencies, and other associations in order to find a resolution to these issues. All in favor, please say aye and raise your hand.
Aye.
Those against, nay, and raise your hand. Seeing unanimous approval, the resolution passes.
Yeah.